Hi everyone, Jiju here. Welcome to Commonsense Economics. This is part 2 of our health economics series, and the topic that we discuss today is very important. That is how to protect your income from a health crisis. A sudden health crisis can be a devastating event, not just for your well-being but for your finance too. Many people have experienced how a sudden hospital stay can shatter their life plans, leading to years of financial struggle. All of their accumulated savings will be depleted like water slipping away through a crack in the pot. So the most relevant question here is how to protect your income or savings from situations like this, stand firm and overcome financially unaffected. Let me set the context first. Medical inflation in India is 14%, which is much above the general inflation. That means every year the cost of treatment will be increasing at the rate of 14%. For example, kidney transplant in India was costing around 5 lakhs in 2013, but now it is around 18 lakhs. Heart transplant in India is costing around 34 lakhs today. Forget about heart transplant. Cost of treatment for heart-related ailments average around 14 to 70 lakhs as per the claims data of health insurance companies. You know, the biggest tragedy is that only 41% of Indian population have health insurance arrangement, and most of which are inadequate also. And 62% of the cost of treatment in India is being paid out of pocket. This is very critical because 23% of that amount is being paid or settled through individual borrowings. This is highest in the world. Imagine the impact of paying money out of pocket for medical treatment. Most of the middle income families will be pushed down to poverty. This is not a personal problem. This is a social problem, and this is a systemic failure, I would say. A recent survey by Policy Bazaar reveals that 82.8% people are aware about health insurance, which is great. We are a well-informed society. But you know the fact, only 34.9% people out of this group is considered owning a policy, and 22.7% have at least taken once. But currently owned is only 18.7%. This is the problem. And Policy Bazaar survey is only about a slice of the population, and the general trend cannot be different. So there is a huge gap between knowing and doing things. This need to be addressed. Let us look at the solution now. There are primarily two ways. One is the physical preparedness and second is the financial preparedness. So let us look at the physical preparedness first. Physical preparedness is a proactive approach. This proactive approach to health can protect your financial well-being. Regular physical activities such as meeting the World Health Organization's recommendation of 150 to 300 minutes per week combined with proper diet can boost your immune system and keep yourself healthy. This will reduce the financial burden of medical conditions, and this we have discussed in my earlier video. Now about financial preparedness. While a reactive measure, financial preparedness is arguably more critical than physical preparedness. This is due to the ever-increasing emergence of new and unknown viruses and bacteria and the resulting diseases they cause. No financial preparedness is as effective as holding a health insurance policy. This will take care of the hospital expenses and provide you with the needy support during such hard times. Let us now look at how to protect your income from a health crisis by availing health insurance. You can avail health insurance benefit in two ways. One is the cashless hospitalization benefit and second is the reimbursement benefit. Cashless hospitalization benefit is something where the hospital bills are directly settled by the insurance company, and the reimbursement benefit is something where you need to pay the hospital bills first and get it reimbursed from the health insurance company. Whichever the method is, health insurance facility is intended to reduce the burden of medical cost on individuals. But still, health insurance penetration in India is very low. There are a lot of apprehensions about health insurance even now. There are other reasons as well. Let us unfold the real reasons. Low penetration of health insurance in India is a complex issue with multiple contributing factors. Let us discuss them one by one. Number one, perceived high cost. Many Indians, especially those in the lower and middle income group, perceive health insurance premium as significant and unaffordable expenses. They often fail to see it as a necessary from the financial protection perspective, and instead they prioritize their immediate needs such as food, house rent and other expenses, etc. Now, second one is financial literacy, low financial literacy. A large segment of the population, particularly in the rural area, has limited knowledge about how health insurance works, what are its benefits and various plans available, etc. Third one is a cultural mindset. Many Indian households have traditional mindset relying on personal savings or family support or even borrowings to cover medical costs rather than investing in a structured insurance plan. Fourth point is the trust factor. Many people fear that their claims will be denied or delayed, or that the claim settlement process will be too complicated. And fifth point is the inadequate public health infrastructure. Public healthcare facilities are often underfunded and lack necessary infrastructure and human resources. This pushes people towards the more sophisticated and expensive private sector where the cost will be much higher. And sixth point is the missing middle. A significant portion of Indian population falls into the category known as missing middle. They are not poor enough to qualify for government sponsored schemes but are not wealthy enough to afford private health insurance. This group, consisting of self employed people and informal sector workers, remains largely uninsured. And the final point is reliance on group health insurance. Many people are covered by group health insurance provided by their employers. People think that that is enough, but unfortunately, it is a myth considering the medical inflation and the cost of treatment associated with hospitalization. So it is high time to change. Everyone need to be covered by health insurance. The latest amendments in GST rules took away the tax on health insurance premium and made it more affordable to common man. So medical treatment costs should not scare you anymore, and you will be able to provide the best medical care to yourself and your loved ones. In the next video, I will explain to you how to select a suitable health insurance provider and how to design a comfortable health insurance coverage for yourself. If you like this video, please subscribe and share it with others. Till the time we meet again, bye bye.